So I was having a conversation with this patient who I've had for years, and she'll get good, and I won't see her for a while, and she comes back in when she's not feeling well. And from the beginning, there's a couple of types of patients. There's patients who are really easy, and we change their diet, and we fix their blood sugar, and we kill off their infections, and we heal their gut, and they're done. They're easy. And then there's some that people that it's like they can't quite stabilize. They're good for a while and they fall back in, and they're good for a while and they fall back in. And I want to talk about those patients because I'm one of those patients. I have an autoimmune issue. I have antibodies to my own tissues, right? And that is never normal. And so if you have Hashimoto's or celiac or MS or lupus or any kind of undiagnosed ANA antibodies or any other undiagnosed antibodies, most of the time you don't know because they're not run. We run a big panel on people for antibodies, and we see really weird antibodies because we look for them. And this particular patient has an antibody, it's in her brain. It's an anti-tubulin antibody, which is like the framework for your neurons. And what I think I want to share is that when this happens and you have antibodies and you're autoimmune, your immune system just doesn't regulate itself the same way that it does when you don't have those issues and we consider ourselves healthy, right? And again, remember that health is on top of the microbiome and other things, but especially the microbiome. It's where our immune system primes. And so when you have any kind of autoimmune issue, you can expect, my patients will look a certain way, they'll behave a certain way, their symptoms will go in a certain way, they'll get better, but then they have to work really hard to maintain it, and they can't go back to just sort of not being conscious of whatever they're doing in their life. And that is usually the indicator that there's autoimmune issue under there that usually isn't diagnosed. So if you have those things going on, it's highly probable that you may have attack against your own tissues. And that is something to be aware of, because then you know that it takes more maintenance for your body to be healthy. So don't ignore those early warning signals because they're legit. Hope that helps.